Hi, it's Dr. Centeno, and today we're going to go over MRI evidence that the Regenexx Perc-ACLR procedure heals ACL tears. So we invented ACL stem cell injections at the Centeno-Schultz Clinic, which is the headquarters of the Regenexx network. Regenexx is worldwide at this point. And the procedure is technically demanding and places bone marrow stem cells, otherwise known as bone marrow concentrate, into the torn ACL using fluoroscopy or X-ray guidance. And the procedure shows good MRI evidence of ACL healing and rapid return to play in about 2/3 of the patients who normally get surgery. So we have to pick the right patients in order to get high success rates with this, but it's about 2/3 of those people who currently get their knee operated. And the procedure is obviously much less invasive than ACL reconstruction, which is tearing out the ACL, drilling tunnels, putting anchors, basically carpentry in the knee. And it's got much less downtime, so it gets athletes back to what they do much more quickly. And we've published several papers on the technique, and we've completed a randomized controlled trial, which is just winding its way through the system to get published. And over the years, we've collected occasional MRIs from select patients that I'll review here. Now, this is not even close to all the MRIs that we've done before and after. These are just the ones that we stopped enough to put online, and I've kind of collected those here. Again, no other clinic or clinic system on earth, I don't care if it's a famous sports medicine clinic that treats this guy or that guy, can show you data like this on a procedure that gets rid of the need for ACL surgery. Now, some of that is because those places do ACL surgery, and this procedure obviously would be a threat to systems like that. And in the meantime, you're going to learn a thing or two about reading MRIs of torn and normal ACL ligaments. So this is a really early one, 2011 we did here. You can see that up here, this shows an actual frank tear. You can see a separation in the ACL. Now, the ACL is going along this way here. And then here you can see that tear heals. And then you can see the whole morphology of the ACL ligament gets smaller, which is great. That means that it's more normal. And this is just, these are sagittal images, so side cuts. And you can see here the ACL should go between these yellow dashed lines. And then as time goes on after the procedure, by this one, the ACL gets a little bit more together. You can see over here on the first one that the ACL is kind of amorphous. Those fibers are kind of going all over the place. But by the second one, it looks better. By the third one, it looks better. And by the fourth one, it looks normal. Now, this is an older patient, so this is something that occurred more slowly in this patient than it would in a younger patient. Here you can see a frank tear in the ACL. Again, the ACL is this dark line that's supposed to go up like this, and it's supposed to be continuous. But you can see on the left, there's a frank tear, and on the right, there's not. This is one of our really early patients from 2010. The ACL should be a dark line that's going diagonally between those red dashes or red dashed lines that you see right there. But you can see it's kind of blown out and light and amorphous, and you can see over time here, from this one to that one, it gets nice and tight and more dense and smaller, which is evidence of healing. You can see here, I've outlined the ACL in that yellow dashed line, and the top part there is blown out and wavy. The bottom part on that left image, so down here, the ACL looks pretty normal. Up here, it looks blown out. Blown out is that light color where it actually gets bigger. And then you can see off on the right, after the procedure, a more normal appearing, darker and denser ACL. Again, everything I've shown you so far is without surgery, just this percutaneous, meaning through the skin, and precise injection of stem cells into the ACL. You can see here that there's actually a tear there, meaning a line going across the ACL. And you can see that that line goes away. And here you have just two different types of images. The one on the left is similar to what you've seen so far, which is called a fat sat, where water is bright. The image on the right is not a fat sat. The image on the right is a proton density image, where you've got the bone is actually bright now and water is also a little bright. Just two different types of MRI sequences. Okay, on the left here, we see a totally blown out ACL. You can see it's bright, it's big, the fibers are going all over the place. And then 3 months later, this is a young person, so it only takes 3 months, you see a really beautiful ACL that was read out as normal ACL by the reading radiologist. Again, no surgery, only the Regenexx Perc-ACLR procedure. You can see images here off on the left. Again, ACL, which should be a nice dark line going in here, isn't. It's this bright, amorphous, kind of blown out thing. And you can see that after treatment, we've now got an ACL which looks darker, which looks more robust. Again, here we have an ACL which has an actual tear in it, which is that white line going across it. And you can see here that the ACL doesn't have that anymore. This is not much of an ACL left there. You can see it's bright, it's wavy, and you can see here a much more normal appearing ACL off on the right. Again, no surgery, just this injection-based procedure. Here, we have an early result, just 3 months later. ACL looks kind of wavy, amorphous, bigger than it should, and here looks nice and dense and dark. And same things here. We have two different images. The ones on the left are both the before, the ones on the right again are the after the procedure. You can see this amorphous ACL turns into this nice tight dark ACL on that type of imaging sequence. Same exact knee here from before, but now we have a fat sat imaging sequence where water is really, really bright, and you can see a nice dark dense ACL after the injection procedure. Here again, we've got an ACL that's really hard to identify. There's very little dark tissue in there going diagonally like an ACL should, but after the procedure, we see that we have some dark tissue going diagonally like an ACL should. On the left, we've got this amorphous thing that is in the general vicinity where the ACL should go diagonally, and it gets some nice form here, although it's still a little bright, still has a little ways to go in healing, but now it's nice, it's denser with actually some fibers all go in the same direction diagonally. Here again, kind of amorphous blown out ACL goes to nice tight dense ACL. We're now looking from the front here as well as the side. You can see that the befores are on top and the afters go this way. So again, kind of larger amorphous blown out ACL goes to much tighter, denser ACL. You can see the same thing happening from the front, but we won't get too much into that since we're looking at ACLs from the side today. So again, we can see here just a progression over time. This ACL is kind of blown out, amorphous, big. You can see it gets smaller, tighter, and denser. And this would be read out as a normal ACL here off on the right. Small, tight, dense, going at a 45-degree angle on the side MRI image. Similar thing here. These are the before images on your left. You can see the ACL between the arrows there, which is kind of amorphous, got some white spots in it here and here. These are just these are just images on the after, which are just one after the other, so a slice and a slice. But again, showing a very nice, tight, dense ACL. This is a front image. The ACL is actually within that little circle I drew. And you can see here that the ACL starts in this image. Very, very bright. It's right in this area here. And then it goes over time to a much darker ligament inside that circle. We're looking at the front of the ACL there. Again, blown out, amorphous, goes to smaller, tighter, denser. Again, blown out, complete ACL tear, and then an ACL on the right that would be read out as normal. Same thing here. We see again, big blown out ACL tear going to something nice and tight. These are two images. This is the before here, and then we go to the after on the side. So we see lots of bright stuff in that ACL, much less bright stuff in that ACL, and then we actually see here a bone marrow lesion, which is where the bone itself got bruised with the initial injury. And then the ACL is in here from the front and it gets tighter and denser. Again, here we see a bright amorphous ACL going to something recognizable as an ACL with these tighter fibers that are darker. So thanks so much for watching. I know that was a little bit of a long slog through lots of images. But I think it's important to show all these images because we have so much data, not only that we've collected on patients about their pain and their function and their ability to return to what they love, but also this incredible MRI evidence, which is really the largest data set of before and after ACL images in existence. Why? Because we invented this procedure. No one else has got a data set like that of before and after ACLs with regard to stem cell injection procedures. So thanks so much for watching. Please subscribe, please like the video, and obviously leave any comments. Thanks so much and have a great day.